Please, I need you to stop what you are doing and listen closely. There is a silent countdown that happens in the human body, a specific set of signals that appear exactly 1 week before a tragedy strikes. Yet, heartbreakingly, 89% of Americans over the age of 65 are completely ignoring them. It is entirely possible that right now, at this very moment, your brain is frantically calling out for help and you don't even know it. I am going to share life-saving information with you today. This isn't just medical theory. This is about protecting your future and the lives of the people you love. So I am asking you to stay with me for the next few minutes. It might just be the most important video you watch this year. Here is the thing that the majority of folks don't realize about strokes. They don't just appear out of nowhere like a bolt of lightning from a clear blue sky. That is a myth. The reality is that for days, and in some cases even weeks before the actual attack happens, your brain is sending you distinct warning signals. The problem? A staggering 94% of Americans dismiss these critical red flags. They brush them off as just stress, or I'm just tired, or the classic excuse, I'm just getting older. Welcome to Senior Medical Hub. This is the place where we cut through the noise and reveal the health truths that no one else is talking about. We are here to empower you. I've seen this tragedy unfold thousands of times in emergency rooms from Chicago to Miami. I look at the medical charts of patients who have suffered massive damage, and it's always the same story. The warning signs were there the whole time. Their brain was screaming for help, but nobody was listening. Let me tell you about Margaret. She's a 72-year-old grandmother living in a suburb of Phoenix, Arizona. 2 weeks before her incident, she started feeling a strange tingling in her left arm. She ignored it, thinking she just slept funny. 3 days later, while making pancakes for her grandkids, she felt a wave of nausea. Again, she dismissed it, thought it was something she ate. Then, on a Tuesday morning, her daughter found her collapsed on the kitchen floor. Margaret had suffered a massive stroke. The tragedy is that it could have been prevented if she had known what her brain was trying to tell her. Now, before we get into the list of symptoms, I have to share a terrifying statistic that the medical establishment rarely highlights. Research published in the New England Journal of Medicine suggests that 80% of strokes are preceded by these phantom symptoms. But here's the shocking part. Your brain actually has a backup generator. It tries to compensate for blocked blood flow for up to 7 days before it completely shuts down. That means you have a 1-week window where you can stop a stroke before it happens. But if you miss that window, the damage is often permanent. We are going to make sure you don't miss that window. Before we continue, tell me in the comments where you're watching this video from, and if you have any personal question or health concern, make sure to share it in the comments. I read every one of them. End of the 10 warning signs. All right, let's dive in. I'm going to walk you through the 10 critical warning signs that appear in that 1-week window. Forget the FAST acronym you see on TV commercials. Those are symptoms happening during the stroke, when it's often too late. We're talking about the pre-stroke signs. Symptom number 1, specific changes in sensation. I'm talking about tingling or a pins and needles sensation. Now, this isn't the feeling you get when your foot falls asleep because you sat on it weirdly. This is different. This stems from the parietal lobe of your brain, the area responsible for feeling touch. When blood flow struggles to reach this area, your nerves start to misfire. It feels like prickling or burning. The key difference: regular tingling follows a nerve path. Stroke-related tingling usually affects one entire side of the body. If you feel tingling in your face, arm, and leg all on the left side or all on the right side at the same time, that is a red alert. Symptom number 2, unexplained vertigo. This isn't just feeling a little lightheaded when you stand up too fast. This is true vertigo, a sensation that the room is spinning around you even when you're sitting perfectly still. This indicates an issue in the back of your brain, the cerebellum, which controls your balance. If you're walking and suddenly feel like you're on a boat in rough seas or the floor is tilting, pay attention. In about 44% of patients with a specific type of artery blockage, vertigo was the very first sign. It often comes in waves, it stutters. It might happen for 10 minutes, go away, and come back the next day. That is your brain struggling for oxygen. Symptom number 4, visual disturbances. Have you ever heard of amaurosis fugax? It's a fancy medical term that essentially means fleeting darkness. Patients describe it like a curtain or a shade being pulled down over one eye. It might only last a few minutes. You might also experience double vision, where you see two of everything. This happens because the brainstem, which controls your eye muscles, isn't getting enough blood. In older folks with hardening of the arteries, this is a classic warning sign. If your vision goes weird and then comes back, do not celebrate. It means a clot passed through, but a bigger one might be coming. Symptom number 5, persistent nausea. This is number 5, and it's tricky because we all get stomach aches, but I'm talking about nausea and vomiting that has no explanation. You haven't eaten bad sushi, you don't have the flu. This happens because the balance center in your brain is linked to your vomit center. When the blood flow is restricted to the back of the skull, it triggers constant nausea. If you feel sick to your stomach and you have any of the other signs like dizziness, do not take an antacid. Take a trip to the hospital. Symptom number 6, the onset of focal seizures. This is rare but deadly serious. A seizure is basically an electrical storm in the brain. When brain tissue is starved of oxygen, it becomes irritable and unstable, causing it to short circuit. This is especially common if the blockage is in one of the main arteries near the surface of the brain. If you or a loved one has never had a seizure before and suddenly starts twitching uncontrollably on one side of the body, call 911 immediately. It's often a precursor to a total blockage. Symptom number 7, the mini stroke or TIA. This is the single most important warning sign on this list. A TIA, or transient ischemic attack, is a practice run for a real stroke. It feels exactly like a stroke, numbness, confusion, weakness, but it disappears in less than 24 hours. Here is the statistic that should make you shiver. A study in Lancet Neurology showed that 43% of people who had a major stroke had a TIA in the 7 days prior. Since the symptoms go away, people think they're cured. They aren't. They're in the danger zone. If you have a funny turn that goes away, you must get checked out. Symptom number 8, sudden clumsiness or ataxia. Imagine trying to pick up a coffee cup and missing the handle completely, or trying to walk and stumbling like you've had too many glasses of wine even though you're perfectly sober. This is called ataxia. It means your cerebellum, the part of the brain that fine-tunes your movement, is offline. It usually develops gradually over a few days. You might just feel off balance or clumsy. Do not ignore this. It's a sign that the arteries in your neck are struggling to feed your brainstem. Symptom number 9, speech difficulties. This warning sign appears in the frontal and temporal lobes of the brain. You might find yourself struggling to find a simple word, or your speech might sound slurred for a few minutes. Maybe you try to say, "the dog is in the yard," but it comes out jumbled. Or maybe you can speak, but you can't understand what someone else is saying to you. These are temporary glitches in the language center of your brain caused by poor blood flow. It's scary, and it's a sign that a major event is on the horizon. Symptom number 10, unexplained mood or personality changes. This is the one that families ignore the most because they just think, "Dad is being grumpy." But sudden, unexplained changes in behavior can be a neurological red flag. We're talking about sudden anxiety, panic attacks, or extreme irritability that is completely out of character. This happens when the frontal lobe, which controls our judgment and personality, is oxygen deprived. If your typically calm husband suddenly becomes aggressive or confused, or your wife suddenly has a panic attack for no reason, look deeper. It might not be psychological, it might be vascular. So, you now have the knowledge. You know the 10 signs, but knowledge is only power if you act on it. If you recognize these symptoms in yourself or someone you love, do not wait and see. Do not wait until Monday to call your family doctor. You need to go to the emergency room and tell them, "I am concerned I am having stroke warning signs." Ask for imaging. Ask for a CT scan or an MRI. Be your own advocate. Remember, time is brain. Every minute you wait, millions of brain cells can die. Margaret, the grandmother I told you about, she is currently in rehab in Arizona, relearning how to walk and speak. If she had known these signs, her story might have been different. But you can write a different ending for your story. We're building a community here at Senior Medical Hub. We help each other. So please hit that like button if this video opened your eyes. Subscribe and turn on the bell so you never miss a life-saving update. And remember to answer my question in the comments. Type 1 if this was helpful or 0 if it wasn't. Your feedback helps us save lives. Take care of that brain of yours. It's the only one you have. I'll see you in the next video. Stay healthy.